Hi, my name is Kate. I will be your student nurse today, and I will be performing a newborn assessment on your baby, if that's okay. All right, can I just get the name and date of birth? Awesome, thank you. And I'm going to put on some clean gloves in order to assess, and then I am going to get some vitals right away, including the temperature, respiratory rate, and heart rate, and everything else. So I'm going to unwrap baby for this assessment, and I'm going to first look at the skin. Just know any discoloration, any bruising, any birthmarks, anything that's abnormal. Just really assess that skin color, and then I am going to check for cap refill. Looks good. And then now I am going to just assess like the overall movement. Seems to be spontaneously moving and seems like a normal muscle tone. And I'm just going to test the startle and moral reflex. I'm going to lift the arms up, and that looks good. Baby got a little startled. And so now I'm going to the head, and I'm just going to gently palpate for the fontanelles, which should be soft. So just note that if they're firm or if they're distended or sunken, anything abnormal. And then I'm also looking at the sutures, see if there might be like a cephalic hematoma or a caput succedaneum, which the cephalic hematoma could be from like ruptured blood vessels, and a caput succedaneum could be swelling from like pressure. So I'm just gently palpating the head, looking for that. Everything looks good. Then I'm going to move to the eyes and know any like jaundice, any look at the sclera, any drainage. And then I'm going to go to the ears and look at the shape and the position, and then know any like skin tags or anything like that. Then I'm going to look at the face, make sure everything looks symmetrical. Everything looks good here. I'm going to stroke the side of the cheek, and the baby should turn to the side with mouth open, which looks good. And then I'm going to move into looking at the mouth. So I'm just going to use my clean glove finger, put my finger in there, and the baby should be sucking. And then also I'm going to just feel for that hard and soft plate, and then look at the mucous membranes, and note like the moisture, color, anything like that. And also look for Epstein pearls, which are just white dots, but they're harmless and they usually go away. So after that, I'm going to move to the neck and just know any like masses, anything like that. Look at the clavicles, and then I am going to look at the tonic reflex for the neck, and I'm just going to turn the head, but make sure you are supporting the head, and the limbs should on that side extend. And you can always have the mother, if they want to participate in helping hold the baby or anything, they can also participate in that. So from the neck, I'm going to now listen to the heart. I am obviously looking at the heart rate, but then I'm going to listen at the apical pulse for heart sounds. And I would listen for 1 full minute. And these sound clear, and I hear S1, S2. Awesome. And then I would go into listening to the lungs. And first, I'm just going to look at the symmetry of the chest. Know if there's anything abnormal. This looks good, so I'm going to listen. All right, looks good. And I would also just know if there's any, like, I see any respiratory distress, and I would also just look for their work of breathing. And then I'm going to move, I would also look at the back and listen to the lung sounds on the baby's back. And here I would, of course, support the head and listen here. And then I'm also, while I'm at the back, I'm just gonna look at the spinal column, make sure it's straight, look for any dimples, anything like that, any hair, cysts, everything looks normal. And then I am also going to examine the abdomen. I want to just note for anything abnormal, and then I'm going to listen to all 4 quadrants. All right, and then I'm just going to examine the abdomen and gently palpate, see if there's firm or soft, or if there's any tenderness. And everything looks good. So then from there, I am going to assess the genitalia. And again, I'm just gonna put the baby on its side and just look at, make sure there's a frequent anus. And then I'm just going to look at the vaginal opening, know if there's any redness or anything abnormal there. Everything looks good. And then I'm just making sure that the labia majora is over the labia minora. And here I could also ask, here I could also like assess the diaper, if there's any coloring or anything there. So then I'm going to look at the arms. I'm looking for symmetry. I'm looking for 5 digits on each hand. Everything looks normal. And then I'm going to feel the brachial pulse bilaterally. There we go. And then I'm going to do a grasp reflex. I'm just going to put my finger, and the baby should hold on to my hand. Grasp, looks good. Then I am just checking for any creases, looking for the creases in the hands and assessing that. Okay, and then I'm going to move down to the legs here. I'm also noting the symmetry and making sure that there are 10 digits, 5 on each. Looks good. And so here I'm going to put my finger, and it should also wrap around on both sides here. And then I'm going to look for the Babinski reflex and stroke the side of the foot, and it should fan out. And then I am also going to do a stepping reflex, where I'm going to hold the baby up and the feet and toes should dangle or wiggle. All right, from here, I am just going to ask about the feeding, if you're using breast milk or you are feeding with your breast or using a bottle. Okay, and then just about how often are you breastfeeding, and what's the quality or amount of milk. All right, and then I would assess the LACT score for when the baby has the nipple, but I am going to come back and do that when you are breastfeeding. And then just some safety concerns. We just want to make sure we have the ID band and the hospital band that makes sure that the baby doesn't leave the hospital, and it has a little tracking device. And then I also want to talk to you about bedtime and the ABCs, which is just being alone in the crib, being on the back to reduce risk of SIDS, and see the baby should be in a crib. And just make sure there's a bulb syringe near the crib for when they're going to bed. All right, do you have any questions for me right now? No? All right, thank you. And I would perform hand hygiene.